But we're on Amendment 490, and 490 raises the HIV/AIDS line by $1.1 million to fund community-based prevention and response programs. So an increase in this funding would prevent cuts to workforce development, any elimination in testing services, and a reduction in syringe service programs. And all these programs and initiatives are really crucial in the prevention of infectious disease. We know how testing services have been so crucial for early detection of both new HIV cases as well as other infectious disease. And that early detection really allows us to prevent further and future transmission, and allows newly diagnosed individuals to receive proper medical care, also partner notification services. The funding also supports safe syringe programs. We've talked a lot about this around how do we further our harm reduction efforts. I think members have heard me talk about in this chamber how the AIDS epidemic has had a profound and lasting effect on my district, especially on the Outer Cape and Provincetown. Certainly, in my own upbringing, I think much of my own attraction to and desire to do work in public health, really stems from that. And several decades into this epidemic, we continue to have public health advocates and researchers sounding the alarm. HIV cases among people who are experiencing homelessness have been in the rise, particularly among those who use intravenous drugs. And these are historically hard to reach populations, but their lives are deeply at risk. And if we don't invest in prevention, things will get worse. We will see future infections. And we've seen these mistakes, recently when, we've rested on our laurels too soon. Health equity is really sort of crucial here as well. And we continue to see a disproportionate effect of HIV and other infectious disease, certainly on the LGBTQ community, but also on Black Massachusetts residents across Massachusetts and across the country. According to the CDC, 60% of new HIV infections are among heterosexual Black women, which is 16 times the diagnosis rate of white women. And HIV/AIDS is now a leading cause of death for Black women aged 25 to 34. So bolstering funding for HIV prevention is going to do a whole lot of good. This is an investment that brings us much closer, not only to meeting CDC protocols, but to the larger dream of seeing a day where there are zero new infections. I'm grateful to my colleagues who see the urgency of this issue, and I ask the amendment be adopted, and when the amendment is adopted, I ask it be taken by a call of the yeas and nays.